Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you learn it all.
And people are
Good question. Good afternoon, everyone, and welcome to A Gathering Place. My name is Marilyn Hemingway, and I am your host this afternoon for A Gathering Place, brought to you by the Galakichi Chamber of Commerce. And I am excited to have with us Linda Lynah from St. James Health and Wellness. And I'm going to put up our graphic here for a moment because there's Linda, and I do have a picture of her. We've had some technical difficulties, and we can't get her camera turned on, but we felt that her information was just so important. We're going to bring her on with us, and then I am going to have her picture so you can see Linda and see what she looks like. Linda, can you hear me?
Yes, I can.
It is so good to have you here, Linda. And as I told everyone, we're having a little technical difficulties, but the information is so important. We wanted to make sure that we brought you on and shared your information with our listening audience. And of course, y'all, you can still post your comments. We will share those comments and questions with Linda as we talk about community health centers and what's going on with community health centers. So, Linda, I'm going to put your picture up here.
Okay.
And then we're going to talk about some community health centers.
Sounds like a good idea. Thank you.
No problem. There she is. Can everybody see Linda there? All right, there. And so, Linda, tell me, what are community health centers?
Okay.
And tell me about the mission of St. James Health and Wellness.
Sure. St. James Santee Health and Wellness is a community health center, and we are proud to serve as our patients' trusted healthcare home. And basically, a community health center, which is also called a federally qualified health center or FQHC. They were established in the United States more than 50 years ago, and that was done by community residents and healthcare providers who believe that everyone should have access to quality healthcare no matter who they are, where they live, or their ability to pay. The health center movement they launched brought doctors and healthcare services into medically underserved areas in all across the country.
You know, I've worked with community health centers, Linda, and I know you've been for years. I've worked with them in marketing. Right. And I really want to emphasize for folks, it really doesn't matter what you can pay. And, right. And what does that mean? In most community health centers, that means they have a sliding fee scale.
Exactly.
Where, you know, so everybody can have access to health care. And this comes out of the civil rights movement. So when you say it's over 50 years old, it's actually about 55 years old because the in the civil rights movement, after Medicare was established, then they established the community health center system. So I think people really need to understand that this actually came out of the civil rights movement. And It's been in our communities working ever since. And I believe there's about 4,800 community health centers around the nation, around our nation, providing those services. So tell me about St. James Health and Wellness.
Sure. Basically, St. James Health and Wellness, our mission is to provide individuals of Berkeley, Charleston, and Georgetown counties access to comprehensive, high-quality primary health care services delivered in a confidential manner with courtesy, compassion, and respect. And just so everyone knows that our funding is supported in part by federal grants, and every community health center by federal law has to meet certain requirements These include, but are not limited to, that they must offer services to everyone regardless of ability to pay, as you mentioned. They must serve an area and or population designated as medically underserved by the federal government. For example, areas, special populations that lack an adequate number of doctors and other basic healthcare services. And then they must be governed by a board of directors that represent the community it serves. So a majority of our health center board members must be patients who use the health center services. We must have in place a sliding scale based on the patient's income and family size. As you mentioned that as far as our services, we are required to provide primary services such as family and or internal medicine, pediatrics and obstetrics or gynecology, and preventive care such as checkups, immunization, and disease screenings. And as far as specific, I'll give you a few of them that we provide as far as services are concerned. We do counseling health services.
Mm-hmm.
We also do teen wellness services. We also provide pharmacy services. We do community outreach. And also, as I mentioned previously, we do have a fee and insurance. The copay that a person may have to pay can range from $0 to $60 per visit. And basically, if an individual, say, does not qualify for Medicaid, but do qualify for the Healthy Connection choice, then we are able to allow them to come and be seen for $10 a visit. And that $10 would include not only the office visit, but it will also include any in-house lab that they may have done.
Oh, all right. Very good. So what is Healthy Connection?
It's technically family planning.
Mm-hmm.
And so with that, you are able to get a physical every 2 years. And then once you've done that, then it goes back to a family planning program. And then in 2 more years, you're able to come back and get another physical.
All right. Very good. Very good. So folks, they operate on a sliding fee scale. What's really important also to know is that their board is made up more than 50% of the actual patient base. So this is truly designed to be grassroots and reach folks who may not necessarily have ready access to health care. So the patients determine the services, determine the direction of community health centers. And I've had the pleasure and honor of helping them with different community health centers with marketing the last few years because what most people don't understand, they are very serious about their mission, providing access to affordable health care across the board, and that's been their focus. But after the Affordable Care Act, there was actually money designated to provide health care education and medical information to the public. So even what that meant is community health centers had a chance to let more people really know about their services and who they were. And you kind of see more of a rebranding of community health centers and really letting people know we're here. We've always been here for the last 50 years plus, but now more people know about community health centers. So Linda, it's definitely an honor and pleasure to have you here to really drill down into what community health centers do, who our local community health center is, St. James Health and Wellness. And we have a comment from Mayor Frank McCleary I'm going to post in a minute. But before I do, Linda, how many locations does St. James Health and Wellness have, and where are they generally located?
Sure. First, I would have to say thank you, Marilyn, for the assistance you give to us. It's really well received. As far as our location, currently we do have 7 locations. We are located in Charleston, Berkeley, as well as Georgetown County. Now, our Charleston location is in McClellanville, And we provide service starting at Highway 41, going up to Allendale, McClellanville, and then going into the Georgetown area. As far as Berkeley County, we're in the upper part of Berkeley County, which includes Cane Hoy, Schuylerville, Alvin, Jamestown. So those are the areas in which we actually provide service. One of the things that we do have is we have a school-based clinic, which is on County Line Road. And then also we have an actual pediatric practice, which is in Georgetown itself. And that's at 57 Jessamine Avenue.
And the pediatric center on County Line Road is actually at Andrews Elementary School.
Exactly.
So that's an in-house school health center, so the kids can have ready access to health care. And it really, I can imagine, it does help parents who are working, but the kids need to see the doctor. So that's a good way for the kids to get their health care while they're in the school setting. Very good. And you also have a location in the Sanford Santee community of Georgetown.
Exactly.
And in the town of Georgetown. Andrews, it's Andrews. And Choppy. So you have a good coverage area. So if you're in the Choppy area, you don't have to travel to Georgetown. They're right there in Choppy where you can get your health care. And you can go to their website and learn more where those locations are and their phone numbers. But since we mentioned Andrews, I'm going to put up this comment from Mayor Frank McCleary. Said, please provide information for COVID-19 testing and vaccination protocol. Thank you for serving the citizens in the town of Andrews. And that's right. Mayor McCleary has been a big supporter of St. James Health and Wellness. And thank you, Mayor McCleary. You anticipated one of our topics, Mayor McCleary.
As a matter of fact, that's the next topic.
That's our next topic, as a matter of fact. So since he was so kind to post that comment, let's go right into it. Sure. What's going on with St. James Health and Wellness and COVID-19 testing? Let's start with the testing first.
Okay, sure. Right now with testing, we do testing at the main site on Wednesdays from 2 to 3:30. And you would need to call and make an appointment, and all persons are welcome. And when you come, please make sure you bring a form of ID as well as your insurance information. Now, the individual that you would call at the main site to schedule testing would be Ms. Alston, and her number would be 843-887-3274, and her extension is 122.
And then what's that number again? 843.
887.
887.
32.
32.
74.
74. And this is for testing.
That's correct. And the extension is 122.
Extension.
And then on Monday.
Okay.
Excuse me.
Go ahead. Extension 122.
And on Mondays, at the Fraser Street site, it's from 8:30 to 12:30. Again, they would be welcome all persons. They would need to call and schedule an appointment. And basically the number to the Fraser Street site would be your 843-436-1333. And just speak with the receptionist, and they would be able to transfer you to the individual that needs to schedule that appointment for you.
So that's 843-436-1333 for the Fraser Street location found in the town of Georgetown to schedule your COVID testing, which takes place on Mondays.
That's correct. And the address is 422 Fraser Street.
Right. Very good.
All right. And then the next location for testing would be on Wednesday at Sampit site. And that's from 8 to 12:30. Again, you do need to call the office to be put on the schedule and bring your insurance. And then also make sure you bring your ID. To make that appointment, you would need to call 843 527-7533.
And what site is that again?
This is your Sandpit site, which is located on Powell Road. And the address there for that site is 2482 Powell Road in Georgetown.
All right, very good.
Okay.
And what other sites do you have?
Those are the three main sites that do the testing.
The COVID testing.
That's correct. With the vaccines, basically, first of all, we don't charge for it. At the McClellanville site right now, we only do it on Fridays.
Okay.
And you do need to call and schedule an appointment. And there are two individuals that you can call and schedule that appointment with. The first is, again, Miss Alston. And that number, again, is 843-887-3274, extension 122. And the second person would be Brenda Perkins. And her number is 843-344-0097. And basically, when you call, then they will schedule the appointment for you and let you know, when to come and what you would need to do, especially like if the waiting area, which they kind of limit the different people that come into the area, whether that person would need to wait in their car or exactly what they need to do.
Because they are practicing COVID-19 safety protocols, just to let folks know. So if you have to bring someone, you're more than likely going to have to wait outside in your car, but they're going to get folks in. And Mayor McCleary, once again, gives us a good question. Is rapid testing available at these locations?
As far as I know of, I believe it's the normal testing. But what the individual can do when they call in is to ask whoever's scheduling the appointment if rapid testing is available.
All right, very good. So once again, at the Sandpit site, I have that on the screen. You can call 843-527-2533 at the Sandpit site to schedule a test. And then at the Fraser Street site, it's 843, am I correct in saying 436-1333?
Yes, you are.
All right, very good. And then the other one for Miss Alston is 843-887-3274, extension 122 to schedule your testing. And those are the main three sites for the COVID testing. So we've discussed the testing. Just call, and if you have any questions, I know they have a great staff, great friendly staff that'll be happy to answer any of your questions. So what about vaccinations? I want to get vaccine. How does that work with St. James Health and Wellness?
Okay, basically, as I mentioned, you would call McClellanville if you're in this area, and I gave that information. And the other location is Andrews, which is for Georgetown. And basically, you would need to call one of the following persons, and they would be able to schedule that appointment for you. One individual is Anna Watts, and her telephone number, you can call her at 843-264-2680.
2680.
Yes, that's correct, for Andrews. And then another person for Andrews would be, again, Brenda Perkins, which is 843-344-0097.
And that's Miss Perkins.
And
that's Miss Brenda Dozier Perkins.
Right. Okay. And then also, you can also reach out to Jerry Davis. And her number is 843-543-4690. And the last person that you can reach out to is Belinda Boyd.
Okay.
And that number is 843-485-1146. And again,
that is Miss Belinda Boyd?
Yes, that's correct.
And what was Miss Jerry's last name?
Davis.
All right. I think
Mhm.
I got them. So we're going to put
Okay.
those up too, folks.
Right. And
So
as
you can see those numbers to get scheduled for your vaccination and see if you're
that's correct.
eligible for your vaccination.
That's correct. And as I mentioned, there is no charge for the vaccine.
Very good. No charge for the vaccine. And if you have any questions, folks, I'm going to leave these numbers up here scrolling across the
Mhm.
screen as we talk. But please call these numbers to see if you are eligible for the vaccinations and costs and any questions you may have. They have a wonderful staff at St. James Health and Wellness, friendly and very serious about health care. And they're going to do all that they can to make sure you get into COVID testing and also get those vaccinations. I think I was saying vaccinations, but you know that's me and my little southern self can't say that C the way it should be said. So vaccinations, folks. So thank you, Mayor McClary, for being so forward thinking that you knew what topic we were going to talk about. But so is there anything else we need to know about that COVID testing or vaccinations? Definitely when you go practice the mask wearing, the social distancing, that doesn't change, folks, just because you're going to get the vaccination. Practice
Exactly.
those practice those safety measures to keep all of us safe as we move forward in this COVID
Ex-
atmosphere. So guess what else has changed because of COVID and under the current administration is we have open enrollment for Affordable Care Act.
Exactly.
And I think that's going to be great for a lot of folks who may have lost their jobs because of COVID, and when they lost their jobs, they also lost their health insurance. And I think the Affordable Care Act is just going to be such a great resource for folks. So tell us what happened with that, Linda, and what are the dates now that open enrollment is here?
Sure. As you mentioned, COVID-19 has changed so much, including when you sign up for health insurance at healthcare.gov.
Mm-hmm.
And basically, the new special enrollment period is available from February 15th to May 15th for states that use healthcare.gov. And here are a few quick tips and facts on the special enrollment period and
Mm-hmm.
calculating income to help you assist um, yourself with getting enrolled. And basically, it says who can enroll during the new COVID special enrollment period. And it's any marketplace eligible person can enroll during this special enrollment period. And this includes people who are uninsured, current marketplace enrollees who like to change plans, and people who are currently enrolled in COBRA and would like to switch to marketplace coverage. As far as when the coverage would start, a person has 30 days to select a plan after they submit their application. Coverage begin on the first day of the month after plan selection. For example, a person who selects a plan on February 28th will have coverage effective on March 1st. And how do an individual apply? Applications can be submitted through healthcare.gov or the call center. The marketplace application questions won't change, but the special enrollment period will be granted automatically. And another place where you can apply is you can call us outreach at St. James, and we would be able to enroll you into a plan, or if you have any questions or need any type of assistance.
Very good. Mm-hmm. Go ahead.
And also, you can enrollees can change their plans. Like if they're a current marketplace enrollee, um, they can choose any plan available in their area with no restrictions. However, if an enrollee switches insurers, money that they already paid towards their old plan's deduction will be counted, won't be counted, toward their new plan's deductible. So if an enrollee choose a different plan with the same insurer, they should check with their insurer about whether the money already paid will be counted towards their new deductible. The other thing is that the standard special enrollment period still be available? And the answer to that question is yes. The questions for standard special enrollment period will be still asked, such as whether you've lost job-based coverage. However, if a person is eligible for a different special enrollment period, the accelerated start dates will still apply, which means coverage starting on the first day of the month after plan selection. And then also the exception is when a person is eligible for an even earlier start date, such as people who've had a birth or adoption and can have coverage backdated to that event. How long does someone have to enroll? And again, we mentioned that would be from February 15th to May 15th. And then also, if you feel that you may be eligible for Medicaid or CHIP, then you can enroll at any time for that program. If a person is eligible for COBRA, they may be eligible for a premium tax credit, even if they're eligible for COBRA, but they can't take both. If a person elected COBRA but changes their mind within the special enrollment period window, they can enroll in marketplace coverage with a premium tax credit and disenroll from the COBRA program. The other thing is that questions have been asked about, do stimulus payments count as income? And the answer to that is no, it does not count as income. These payments do not count as income for Medicaid or premium tax eligibility either. The other question that a lot of people have is, do unemployment benefits count as income? And basically for premium tax credit eligibility, all unemployment benefits, both state and supplemental federal benefits, count as income. However, for Medicaid and CHIP eligibility, the current $300 per week federal pandemic unemployment compensated is excluded for income, while other unemployment benefits do count. In the healthcare.gov, you would enter all unemployment on a weekly or monthly basis, not annual, and healthcare.gov will subtract the $300 per week payment to determine Medicaid and CHIP eligibility without your application having to make any manual adjustment. And basically you won't see this subtraction in the monthly income amount the application, displays. Mm-hmm. As far as making income calculation is especially tricky now. And basically the advice they give you is always enter the current monthly income. This will help determine someone's Medicaid or CHIP eligibility, and annual income will automatically be calculated as a multiple of monthly income, but might not reflect the consumer actual situation. And if that's the case, enter a different annual income in the application. Healthcare.gov has a handy worksheet to help calculate annual income that more closely reflects the client's situation. And remember to ask about other types of income that are more common among people who've lost a job, like withdrawing money from a retirement plan or an IRA. Given certain income, some people may generate income, what is called data matching issues. When resolving the income data matching issue, remember to include all sources of income. If pay stubs or similar documentation isn't available, a letter that attests to each source of a consumer's projected income might be sufficient. And for people who are already enrolled in coverage, may need a mid-year eligibility checkup to see if they qualify for a larger or smaller premium tax credit or for Medicaid or CHIP. So
that would be for folks who maybe lost their job in the middle of the year.
Right.
And you need to go back to healthcare.gov and update your information.
Right.
Okay.
Or it may be for someone that lost a job, got a new job. The income is different from when they initially applied as well. Any kind of income change, you would definitely want to go in and report that change to see if it makes a difference in how much you pay for your premium.
Okay. Very good. Very good. All right. So what else do we need to know about open enrollment? So folks, Linda's here. She's talking about the new open enrollment. especially in the time of COVID. And this is open now until May 15th. Did I hear correctly?
That's correct. That's
And
correct.
that's actually longer than what happened at the end of 2020.
Yes.
Yeah,
Because
so
the
we have more time.
yes,
Okay.
that's correct.
But don't wait to the last minute, folks. We can't, just because
Exactly.
we have more time, don't wait until the last minute. If you are in need of health insurance now, go to healthcare.gov and determine your eligibility, fill out the applications, and get it rolling. Don't wait to the last minute, because a lot has changed regarding income.
Yes.
And folks need to take that into consideration. Very good. What else do we need to know, Linda, regarding the open enrollment? Any other information we need to know?
That's basically it. Knowing when the enrollment date, knowing what the expectations are, and then also people understanding that with them being in this special enrollment period, they don't have to not be able to enroll. They can, because of the COVID, and not because of quote unquote a special enrollment change. So if you think that you may need to change your plan because your situation has changed, then by all means, please feel free to either contact myself, Brenda Perkins, Jerry Davis, and we can assist you with that.
All right, very good. I'm glad to hear that. About open enrollment, that's important. And even for folks like me, I'm self-employed, I own my own business. I get my health insurance through healthcare.gov. And let me tell you, it's a load off my mind to know that I have health insurance, because we are of a certain age now that becomes important.
Exactly.
Exactly. So we don't want to fool around with that. But Linda, before we go on, I want to say congratulations
Thank you.
on your award, y'all. Linda won an award, and let me get the title correct here. It is the Community Health Center Advocate Award. Am I correct on that?
Yes, you are.
It is presented in recognition of exemplary efforts to promote community health centers, expand community health center grassroots, and educate people about the many ways in which they call them CHCs for community health centers, benefit their communities. It is intended to honor CHC staff and board members who contribute significant time and effort into advocating on behalf of their health center patients and community. And this year's awardee is Miss Linda Lynah from St. James Health and Wellness. And that is another reason why we are so excited to have her here with us. And I want to make sure that I show some pictures. I do have some pictures, Linda.
Okay.
A couple pictures, and one I know she is we have you with Senator, let me get that one. I want to save the other one for last. And I think I know
Okay.
which one I'm talking about. We want to, let me get to that. I'm just so whoopsie here. All right. This is a picture with Senator Saab at one of the locations on St. James Health and Wellness, and he's giving an award for recognition for National Health Center Week. And I'll let y'all know, National Health Center Week, the reason I really wanted to share this picture is the annual advocacy week for national community health centers. All of the community health centers use the week of August, the first week of August, to really promote and advocate for community health centers. And it has gotten so big that some celebrated the entire month. But through the hard work of Linda, she really is out here recruiting advocates and just getting the word out about St. James Health and Wellness. So we want to definitely give her kudos on that. And of course, Mayor Frank, let's throw his up. He says, congratulations also, Linda, from
Thank you.
Mayor Frank McCleary of Andrews. And then we have our one more picture. And who knew that Linda was so good that she anticipated who was going to be president and actually invited him to St. James Health and Wellness. And our current President Biden spent some time with the staff and Miss Gilliard, the CEO of St. James Health and Wellness at your headquarters in McClellanville. And the
Yes.
picture we are showing now is Miss Linda escorting him, I believe, to the podium so he could say a few words.
Yes, that's correct.
So this is so exciting. You look really good, Linda.
Thank you.
That was a
Thank
beautiful
you.
thing. You're looking
Yes.
good. And
Yes.
with President Biden, and he is a huge supporter of community health centers. And I
Yes.
mentioned this, and I mentioned Linda's award because we do want to give her kudos for the hard work that she's doing in our community to build relationships on the grassroots level and to let people know you have access to health care through St. James Health and Wellness. But I also wanted to mention this is that we are always looking for advocates for community health centers. We're always looking for advocates for St. James Health and Wellness. So, Linda, now that I've said that, why are we looking for advocates? Can you share that with us?
Sure. Well, first of all, everyone, your voice does matter. And American community health centers have earned public and private support for decades because they are lower cost while providing quality health care and saving lives. But there is never a guarantee that the health center mission will continue. And that is why your voice as a patient or a community individual is important. If you would like to support community health centers, then you can visit the National Association of Community Health Centers at www. And I'm going to say the letters individually: N as in Nancy, A as in Alpha, C as in Cap, H as in Harry, and C as in Cat.org. And that's called NAC. And then sign up as a grassroots healthcare advocate who speaks out for your local health center and health centers throughout your state and nationwide. Also, if you could spread the word, talk to your friends, family, co-workers, community and political leaders, and ask them to become an advocate too. Community health centers are good for America.
Yes, they are. And I'm going to put that up here. www.nachc.org. That's NAC. And what does that mean? National Association of Community Health Centers, folks. I've had an opportunity to attend a couple of their national conventions. Very educational, very informative, and always talking about how they can create even greater access to health care to all of our communities, regardless of income. Regardless of income, folks. And we just need your help in spreading the word about community health centers in our location in Georgetown, St. James Health and Wellness, and their services, but also becoming an advocate because they're funded by the federal government. And it does come back around. That is not permanent. A great deal of that funding is not permanent. So every year we have to go through where we call our senators and representatives in Washington and tell them, keep funding community health centers, keep funding community health centers. And the nice thing about community health centers, most of them are 501c3 organizations. And if you want to make a donation to St. James Health and Wellness, they accept donations also. So keep that in mind. But the majority of their funding comes from the federal government. And before we go on to our next topic, I want to remind everyone, we'll take a quick station break, that you are watching A Gathering Place, brought to you by the Gullah Geechee Chamber of Commerce, hosted by Marilyn Hemingway. And today our special guest is Miss Linda Lynah of St. James Health and Wellness, talking to us about COVID testing, COVID vaccines,
ACA.
Thank you. There's so much. Affordable Care Act, open enrollment until May 15th. Some of the services of St. James Health and Wellness and their locations. And we're going to bring Linda back every fourth Wednesday of the month to talk more about community health centers and the services they provide. And I wanted to just take a few minutes to give a monthly theme. We're going to do a monthly health theme. And I want to talk about this month. It's the month of February. And in this month, what do we focus on? Two things: Black History Month and also American Heart Month. And I wanted to mention American Heart Month because in the Black community, high blood pressure, heart issues are serious. It's some of the top causes of death in the Black community. And I wanted to make note of the American Heart Month. And if you go to the NIH, National Heart, Lung, and Blood Institute page, just Google it, nhlbi.nih.gov, and that's the National Institute of Health. Just go to their page, nih.gov, National Institute of Health, and look up Heart Month, and this information will come up. They have 25 ways to take part in Heart Month, and then also they have, and I may need to back out quickly to get to this, they have 7 self-care tips. 7 self-care, there we go. 7 self-care tips, and I want to make sure that we get there. Let me see if I can put, there we go. 7 days of self-care. Mindful Monday, know your blood pressure numbers and other heart stats. Tasty Tuesday, try a tasty heart healthy recipe. Wellness Wednesday, put your heart into your wellness routine. In other words, cardio. Treat Yourself Thursday, treat your heart to some relaxation and fun. And today, even though it's Wednesday, it was a beautiful day. And so hopefully tomorrow it'll be the same and we can do some relaxation and fun. Follow Friday, share who inspires you to show your heart more love. Selfie Saturday, post your favorite way to take care of your heart. And then Sunday is Self-Care Sunday. Create your self-care checklist for the week. And I want to share that with everyone. And I don't think I actually got it in there, but we're going to make sure that we have it on our Facebook page. And so that this month is American Heart Month, and we want to make sure that everyone takes care of their heart, especially in the African American community, because so many of us, we have heart issues, high blood pressure, and we need to take care of our heart, folks. If you have any questions about that, we're here. But just go to our Facebook page and look for what we posted. All right. So, Linda, did we cover all our topics today?
We did. And
we had a list. We had a serious list here.
Yes. And I just wanted to let everyone know that if they have questions or they need to or would like to talk with me further, they can reach me at area code 843-826-3773.
And what is that number again? That is,
it is area code 843-826-3773.
All right, and this will give you Linda Lynah with St. James Health and Wellness, and she is the community outreach liaison. She has big title. And we just want everybody to, reach out to Linda and do what you need to do to stay healthy.
Exactly.
All right. Yeah, and she's here, and St. James Health and Wellness, they're here at 4 locations in Georgetown, or 6. There's so many. And I think Andrews has about 2 or 3 in Andrews alone, and at the school. But folks, take advantage of St. James Health and Wellness. They are here for the people and the grassroots, the folks that we too often forget about. But they're just like you and I. They're our neighbors, family, and friends. I have used St. James Health and Wellness. I think I definitely have used them. And for services, and they provide wonderful services. There's Latasha. Thank you, Latasha.
Thank you, Latasha.
This is my girl, Latasha. She got me. She's got me handled. She's taking care of it. Thank you, Latasha, for sharing Linda's number there. All right, everybody. If we don't have any other questions, Linda, I want to say thank you for coming today. And next time you come on the 4th Wednesday, we're gonna get this camera straight now. We're gonna get this camera straight so we can see you. But the picture's wonderful, beautiful picture. So
thank you.
Always excited to have you, Linda. And we can guarantee when Linda and I have Zoom meetings, the camera has been working. But today is decided that I don't want to show up. Let Linda, I don't want to show up. But we outsmarted that camera, and we just got her picture up there. So, Linda, good to have you with us today. We really appreciate it. And we will definitely see you next fourth Wednesday in March.
Uh-huh.
And with more updates on what's going on with COVID testing and vaccinations, and also more services brought to us by St. James Health and Wellness. And of course, I'll bring the theme of the month. That's my job, theme of the month. And any other information we need to know from our community health centers. I'm looking forward to it also.
Well, I just want to say to you, thank you for having me on the show. And we definitely, would love to get the information out to everyone that we can. And then also, from time to time, unfortunately, because of the COVID, it has limited us, but we do community events where we recently did community testing. And hopefully we'll be able to do community vaccines as well.
All right.
That's something to keep in mind. And if you have a concern or whatever, please feel free to give me a call and I'll be more than happy to talk with you.
Very
and the
good.
Blessing is that you don't have to be our patient for us to assist you with Medicaid, Medicare, food stamps, health insurance marketplace, things of that nature. And even like in some cases to direct you where to go if you're in need of getting medicine.
Very good. And that's good to hear, Linda. And of course, send me the information. I will make sure that it gets out to the Gallagher Chamber Facebook pages, the Gallagher Leadership Institute pages, and all the other pages that I have contact with. And we'll get it out to the media because we got to remind everybody too, St. James Health and Wellness, they were they are a charter member of the Gallagher Chamber of Commerce. They have been very supportive from day one, and we've done some good work together. And if you join the chamber also, we'll help get the word out about your business and help your business to grow. And that's what we're about, collaboration and collectively working together to help our community and to grow our businesses. So it's always been a delight working with St. James Health and Wellness. And Linda, I want to say thank you again for coming on the show today.
You're welcome. Thank you.
All right. You have a good one. And thank you, Linda. And we'll see you later.
Okay. Bye-bye, everybody.
And I just want to remind everyone that every Wednesday and Sunday at 4:00, we have a gathering place. And this coming Wednesday, we have joining us Tawana Winley, author of Another Level, How Changing Your Mindset Changes Your Circumstances. And I must say that I am excited to have her join us this coming Wednesday at 4:00 to talk about this, because I am a living witness that